Hi, this is Dr. Donald Fox, orthodontist. I am also an expert in different habits of thumb sucking, finger sucking, toe sucking, blanket sucking, and yes, binkies, pacifier sucking. You probably want to know why would you want to look at reading about a book that does this versus why doesn't the dentist know how to stop this problem? The dental field never has figured this problem out and uses different things, I call them crutches, that doesn't address the real problem that a child has, because the child actually is making a decision every time to put their thumb in their mouth or their finger, and they're causing damage. But in the dental field, it's resorted to things like there's a plastic guard that you put over the thumb called a thumb guard. And it's very frustrating to the child. It can take weeks and weeks and weeks for the child to stop. Also, there is gloves that are black gloves. And again, the child just takes these off, but again, doesn't address the problem. It's almost like a situation where you got somebody that's smoking cigarettes. Why don't we just duct tape their mouth or other techniques to get rid of the smoking versus helping the person to get the decision to stop the sucking to stop smoking. Same thing with sucking. There's also dentists and pedodontists, children dentists, will put a device that's glued to the back molars. You see these rings here, and it's got a crib, and some of them have little sharp barbs. And then there's one down below that has sharp barbs. And it really makes a child feel bad because they don't know how to stop when they just know that they need to stop. Also, let me get over here to the damage. The biggest thing is the thumb can push the teeth up and out, but more importantly, it can take those back upper teeth and suck them down so that now the bite is open. Now these are baby teeth back here. Now we don't want the permanent teeth to come into this position, or the patient would need to have braces and jaw surgery. Also, you need to find an orthodontist like myself. It's hard to find someone who's very well trained in early treatment at age 6. I have a master's degree in dental facial orthopedics, which means basically I know how to alter the bone structures of the face. I can get the upper bone structure here to grow out. I can get this lower jaw here to grow out if the upper teeth are bucked out, but the child has to be in my hands around age 7. A lot of orthodontists have trained somewhat in that, but don't have formal degrees in it. I actually have treated over 7,000 patients with facial deformities, particularly at age 6. Particularly in this case here, this patient here, when finished, all the teeth came down, and we also handled getting the mouth fully under control so that the patient didn't have jaw surgery and didn't have any permanent teeth out. So I hope this helps you today realize that Sucksucker Revolution has 37 techniques that you can try one at a time with your child if it's something very mild, but really there's 3 chapters in this book that addresses the problems of why the child is making the decision to stop or not stop thumb sucking. And these are very powerful. For matter of fact, a parent, particularly a mom, this book was written for a mom, not a dentist, that you read this book on a Saturday and Sunday, roughly 6 hours each day. Very easy, fast, interesting read for you to understand what is going on behind your child's problem. And then you apply it only takes about an hour to hour and a half sitting down with the child once they're well fed, well rested, because you gotta have their attention and they need to be able to talk to you. Yes, this book works as early as age 2, as long as the child can talk to you and carry on with sentences. If they can't carry on sentences and they're just distracted or they're bouncing around, you're going to have to wait another 6 months, because you're going to get very frustrated that the book doesn't work because the child's just too immature. But there are many, I've seen as many as half of the age 2 children can carry on a very good conversation about a movie or something they saw, and you sit down with them and you'll know right away when you read the book and then you go to use it whether they're paying attention to you. but the book works, and it really is very awesome. There's nothing negative in it, and the child feels good, you feel good that they stopped, particularly this embarrassing habit once they're doing it out in public or their friends find out. Again, it's Stop Thumb Suck Revolution. It's at www.stopthumbsuckrevolution. It's available at Amazon, Barnes & Noble, Apple, iBooks, Nook. It's in digital and paperback. Again, Dr. Donald Fox, orthodontist. I have offices from Boca Raton, Deerfield Beach, all the way down to South Beach in South Florida. And I've been practicing for 31 years, and I really enjoy what I do, and I look forward to helping you. Thank you.